My name is Nathan. As you heard, I use he, him pronouns. I'm proud and privileged today to share this space with two wonderful colleagues and organizations, Jada Hicks from the Center for HIV Law and Policy and Kamaria Lafferty from the Zero Project. What I'd like to do is start with Jada, an introduction from Jada, and an introduction to HIV criminalization, HIV Criminalization 101. Then I'll share some Williams Institute research findings, some of the who and how of HIV criminalization, and then we'll go to Kamaria to hear how people most affected by HIV criminalization are leading the charge to change these laws and policies across the United States. But hopefully everyone can see my slides. Why don't we go with the material as it's presented here? And as Jada says, we're happy to make the slides available to you afterward. My name, as you heard, is Nathan Cisneros. I use he, him pronouns. I'm the HIV Criminalization Director at the Williams Institute. The mission of the Williams Institute is really to provide fact-based, independent, rigorous, policy-relevant analysis to key stakeholders. That could be anyone from advocates to legislators. And we've been looking at HIV criminalization now for 10 years. I should say HIV criminalization as a phenomenon in the United States is actually 40 years old this year. In 1986 is the year in which the first HIV-specific criminal law was passed. So here's a roadmap of where I'd like to go. I'd like to step back. Jada gave us a brief history of HIV criminalization in the United States. I'd like to dive a little bit deeper, and then I'd like to share what we know about HIV criminalization in the United States from Williams Institute research. So let's start with some of that history. As Jada said, most of these HIV criminal laws were enacted at the height of the AIDS crisis in the 1980s. I have written down that many of the laws were passed before we understood how HIV is and is not transmitted. That's not quite accurate. We had good science on HIV transmission even in the mid 1980s, although that knowledge wasn't widely diffused, and certainly policymakers maybe didn't have access to that information, or at least not readily at hand. It was certainly before we had effective medications to both treat and prevent HIV. But when you look at the legislative record, you find that many of the laws were motivated by fear. The fear was often racialized. There was a lot of homophobia. In the early days of the AIDS epidemic, there was the association with the so-called four H's: homos, Haitians, heroin users, and hemophiliacs. Haitians in here is interesting. It's quite a coded term. It's being racially coded and then also coded for people who are not from the United States. And as Jada mentioned, the original Ryan White CARE Act tied some federal funding to the enactment of these criminal penalties. I won't belabor the point, but the media have not done a good job at covering HIV in general and HIV criminalization in particular. These are headlines mainly from the 1990s. If I pulled headlines from the last few years, they wouldn't be unfortunate. Well, they would be a little bit better, but I think that they would still be missing a lot. You still see a lot of medical misinformation. You still see a lot of assumptions and fear and stigma associated not just with HIV, but HIV transmission cases. This is a map that actually, or a plot that actually shows the year of enactment for HIV criminal laws across the United States. And I drew a red line there. That's when the Ryan White CARE Act came into force. And you can see many states actually had started criminalizing before Ryan White. And then you see a number of states afterward. And you can see actually Florida is one of the first states to criminalize HIV all the way back in 1986. But as recently as 2011, there was a new HIV criminal law in Nebraska. Let me give you an example of what two criminal laws actually look like. These are both from Indiana, both of them essentially criminalizing the same thing, that is fluid exposure, and really only fluid exposure in the context of exposures that cannot transmit HIV. So these two laws are essentially only criminalizing behaviors that we know are not HIV transmission routes. For example, spitting at somebody, throwing urine or feces at somebody, right? So it lands on somebody's skin or clothing. It's not an HIV transmission route. And yet we have two laws. One of them, the second, called malicious mischief, and passed as recently as 2002. We actually know how that law came about. This article was discovered by one of our colleagues in Indiana. The story, as reported in the news article, was that a high school student dumped warm water on another student, claiming it was urine. The child told their parent. The parent took them to the doctor. The doctor recommended HIV and hepatitis testing for the next 12 months. Again, this was water, but even if it was urine, this would not be medically appropriate here. A legislator found out about this, decided to introduce the law. That's what the malicious mischief law that's the origin of the malicious mischief law. And you can tell by the name how it's related to this story. Again, it only criminalized behaviors that cannot transmit HIV and singled out HIV and hepatitis for harsher treatments. Let me go into what we know about HIV criminalization in the United States. So who's being affected by these laws? And I want to give you a few covers. So we have 40 years of HIV criminalization in the United States, and now a decade, 10 years of HIV criminalization related research at the Williams Institute. And it's in small print, but that second name on our very first report on HIV criminalization here in California was Ayako. Ayako was critical in starting this line of research at the Williams Institute. And we've been fortunate enough to continue that research ever since. We now have 25 reports across 16 states, including here in California. And I should say, this report and a couple of others from that initial research push were instrumental in reforming HIV criminal laws in in California. Unfortunately, people living with HIV still can be criminalized in California, although the circumstances are dramatically restricted. Let me give you a high-level summary of what we know about HIV criminalization across the United States, and then I'll show you the same information in a few figures. So
Nathan,
first,
can I just
yeah,
break in for 1 second? I'm
go
sorry.
ahead.
Um, just wanted to do a time check and say we have about 10 minutes left for both you and Jada to ensure we have some time for questions. So please keep that in mind.
All right, I'll be very brief. And maybe I'll just stay on this slide, and I'm happy to share fact figures later on. But I just want to emphasize most arrests and prosecutions are pursuant to laws that don't require transmission, the intent to transmit, or even a substantial transmission risk. We've counted just across these reports, thousands of people have been criminalized because of their HIV status. We know that criminalization is continuing to this day. Every state in which we request data, we find people being criminalized because of their HIV status. And we know that Black people, women, and sex workers are often disproportionately affected, sometimes dramatically so. And I'll share a link to a recent report on Black Americans and HIV criminalization in the chat. And additionally, we've seen that enforcement tends to be geographically concentrated. So this tells us that it's more about policing or prosecutorial practice than about public health. And finally, as Jada mentioned, there can be lifelong consequences, felony convictions, sex offender registration, which can really substantially affect your life course afterward and create its own cycle of criminalization. Why don't I stop there? I'll be happy to answer any specific questions in the Q&A portion, but I'll turn it over to my colleague Kamaria now and her set of slides.